higher tendency to go back to autologous bone. Because I noticed that when I do vertical GBR, just like the last study I showed, 26% failure rates. And most of those were using the sausage technique. Okay. So I have a high tendency going back into autologous bone because I noticed that sometimes when you use bio-oss, if the bio-oss is not integrated well enough when you, after grafting, when you put the implant in, you may have high risk of peritonitis. So what do I do? When I look at patients like that, all right, you can see the bone is good, but the right lateral incisor is the problem. The good thing is that no mobility, but that's severe attachment loss. Why? Because this is what you see. This is what you see. So the classical bone is here, that means the classical bone is here, that means no matter what I do, the regeneration is going to be somewhere here, right? So what I'm going to decide to do is to go in there and this is how it looks. And what I'm doing is take some bone from the rings. Offers a piece of block. And section the block so that I can use it for the buccal aspect of the defect. Like this. Then I'm going to fill with autologous barrier in between, let it heal. I don't know why I use PIF because they give me the machine. I don't think it does anything. It's just like, just put something there. Very little scientific evidence. So I want to make sure you understand. This bone plate, once it's got detached from the rings, the cells are starting to die. There's very little life to this two pieces of bone plate. But I just want this piece of bone plate to serve as a matrix for me. Very little anything else. The key is the bone right here. This is what I want. Okay? So in test, I want to make sure on this case, I intentionally graft over the interproximal bony plate. I mean the interproximal bone, OBP. Because I want to try to gain back that attachment. So this is 4 months after surgery. The good thing about using autologous bone is I can re-enter the surgical site between 3.5 weeks and 4 weeks. I mean 3.5 months and 4 months. Whereas if I do any type of grafting, especially with graft material like xenograft, aerograft, I need to wait probably 8 to 9 months. At 4 months, I'm going to enter the surgical site. This is how the surgical site looks like at 4 months. This is the day of the surgery. This is the day of the 4 months later. So I want you to look at something carefully. If you look carefully back here, I want you to look at, remember right here, the bone is here. I try to extend the bone above the bony peak. I try to graft that, and this is how it is. But I want you to look at the patient at a different angle. I want you to look at, you see the palatal bony plate, the facial bony plate? The facial bony plate. What do you see here? You see the bony plate? There's no connection between the bone and the plate. You see that? It's just a piece of plate sticking in the air. That means it's so hard to graft over the bony plate. You understand that the bony peak, and on top, grafting onto two surfaces is very challenging to be possible. Regardless, fully guided surgery, implant placement, I don't know why I told you. They give it to me for free to use, so I just use it. And then suture everything. So 4 months post-implant placement, I'm going to uncover it. And usually what I do is I use provision to incrementally expand the soft tissue, to the position I want it. All right? So at 1 year. Now my soft tissue is pretty close to the shape that I want to use to control, to develop my emergent profile. So once again, I use my provision to train my tissue so that I can get the tissue how and where I want it to be. Final crown. And let me tell you, 2 years after that, when I delivered the crown, shortly afterwards, the patient complained. I said, what's wrong? He said, you know what, I don't like this area. Well, what do you mean? It looks a little bit higher. I said, well, what do you mean it's higher? I said, it's pretty normal, right? He said, no, I don't like the shape, so I go in there and remove the crown. I did some contour. From here to here. From here to here. That delivery. She's happy with that. Six years follow-up. So at 6 years, I actually removed the crown and take a look and see how it looks like. The dynamics of the soft tissue. Years, the background, block. 8 years follow-up.